Hello, my name is Marie Stella. I'm from Chesterfield County, Virginia. I'm disappointed that I have to come again to try to support Medicaid expansion. I think it would be done by now. But I guess you'll hear a series now of what I call Medicaid myths. So I'd like to go over them as quickly as I can. The government is going bankrupt. I don't know if this came from Nostradamus or our own Edgar Casey, but the way I look at the economy right now, the way most people look at it, the debt is down, unemployment is down, and housing is up. That's usually the sign that we're in good condition, we're getting better. So if the government does go bankrupt in 2017, I don't think we have anything to fear because there'll be no schools, no roads, no clean air, no clean water, and we'll be a third world country. So let's just hope that whoever is the prophet telling us this is wrong. The second myth, people who get Medicaid are lazy. States that keep records of who gets Medicaid show that 25% of the people work at Walmart. And people who get Medicaid are not lazy. They're working families, they're families of veterans, they're handicapped children. They're premature children that it costs us almost $1 million to get out of the hospital when we probably could have given prenatal care to those families and helped them a lot more. Myth 3, all veterans get benefits. I even read an article in the paper yesterday or the day before where someone said that. Maybe they meant all veterans should get benefits, but we definitely know now that they do not. I paid for my Medicare and Social Security. That's my age group, who thinks that they paid for everything they got and no one else deserves anything. Well, if we put a cap on our benefits based on what we paid, we're going to be really hurting, especially those of us who live to be in their late 80s or 90s. And I don't think they'll be here in force the way they're against Medicaid expansion. Another myth, the state can't afford it. We used to be the best run state in the nation, according to Forbes and Bloomberg, both conservative institutions. Now we're the most amusing state. We are a 10%er state. We are the richest, we're constantly in the richest 10%, and we're constantly in the lowest 10% for benefits and corporate taxes. We don't have a tax break for business in Virginia that we don't love. Whether it's building roads to bring Amazon in so we can pay low wages and build boxes so we can ship foreign products overseas, or bringing imports from the port and not making things ourselves, being innovators. I'm sorry. And I would like to say just that we think privatization is better. Look at the 460 project. Look at DETA. Do you think a corporation can handle our money better? Okay, I just want to finish by saying, if you can't do anything else, support the 2-year McCullough plan. We'll save money by providing preventive care and early benefits to people instead of these long-term horrible care, and it'll be good for the economy. Take the money.
Thank you very much.
Thank you.
Good afternoon, Chairman and Commission members, committee members of public. My name is Mark Ryan. I'm a family physician here in Mission, Virginia. And I'm here speaking on behalf of myself on the National Physicians Alliance chapter in Virginia, as well as medical students at the Commonwealth University chapter of the American Medical Student Association, and other medical students who were unable to join us this afternoon due to their apparently time-requiring commitments in their medical studies. They keep telling us it's getting really hard, and they keep telling us it gets better, so we hope that it wants to get better. I'm here today because I'm a family physician here in Virginia who has worked my entire career with medically underserved communities. I did my residency program in Blackstone, Virginia. I practiced 4 years in Charlotte County, in Keysville, in a town of 900 people. And I came back to Richmond 7 years ago specifically to work with uninsured patients. I'm fortunate to work in a place where patients who lack insurance can access care in a couple of different settings. But because of that, I can speak to the challenge that's faced in many cases. I was not able to join the first part of the meeting. I was in line to come in, as many of us were. I presume that the discussion included the fact that Medicaid expansion in other states has been associated with decreased mortality and significant health care benefits in other parts of the U.S. Evidently, the conversation's already covered the coverage gap in which our lowest income citizens in Virginia currently lack access to healthcare services that would otherwise be available to them if Medicaid were expanded and Medicaid flows. We know that lack of insurance reduces use of necessary screening tests. We heard about colonoscopies earlier. It's true of mammography, and it's true of other necessary healthcare services as well. I presume that you heard earlier that the change in DSH funding for hospitals will end up costing potentially millions of dollars to safety net hospitals, both in urban settings and teaching hospitals in Virginia, but also rural hospitals in Virginia that are key points of contact. And as a volunteer in a free clinic here in Virginia Richmond, I can speak for the fact that the free clinic system, which is a noble, incredibly hardworking, incredibly dedicated group of volunteers, is stretched to the limit. A safety net is by intent supposed to be a safety net. It should catch those that don't have any other recourse. Yet more and more folks are having to come to the free clinics as a primary point of care. When I work in those settings, when we see patients coming for the first time, we finally get past the waiting lines, the access issues to get in to be seen. We are usually struggling to figure out which of their many uncontrolled medical problems will be the one that we have to focus on most urgently. Because it's not uncommon for them to have uncontrolled diabetes, hypertension, blood pressure, maybe some heart disease, possibly mental illness, and oftentimes other medical issues that come into play. We find ourselves having to decide with those patients which $4 prescription is the one they can get right away, because they can't afford two $4 prescriptions. We find ourselves struggling for access to referral sites with patients with specialty care. Expanding Medicaid coverage to cover the gap and close the coverage gap in Virginia would address all of those issues. It's past time to do something. We should move forward now.
Thank you, Dr. Arnold. Is Manny still available? No, I think she had to be early.
Is she number 15?
Yes, 15, number 15. Do you introduce yourself?
My name is Herb Walk. I live in Chesapeake County, Central Washington, used to represent me, it's changed around a little bit. I wanted to share some personal things with you. I represent myself, and I wasn't planning on coming in here today until I got one pulled up from my delegate, Robinson, that told me all the problems that why we shouldn't do this. And I started reading it, and I spent a career in industrial engineering and accounting and finance at one of our major corporations that went away back a few years ago, and I started my own consulting firm. And I've got to see a lot of businesses and how things work. But I've had a couple of things that happened to me in the last year I want to share with you. I lost my wonderful wife last year, and she had rheumatic fever when she was 6 years old. But I was very fortunate, we were fortunate. She taught in the public school system for 35 years. So we had good insurance. We had good insurance because I worked for Reynolds Metals. And so our insurance was taken care of. We were in very good shape. And then last couple of years ago, rheumatic fever came back and valves needed to be repaired. And she had wonderful care at MCV and UVA. And to shorten the story a little bit, she got an infection and that took her out after the wonderful operations they had done. But in the process of that insurance process, they had to restate a few things. So I got this magic bill from UVA, except for the Board of Visitors and the Rector, $1,069,000. It makes you look back very quickly. I knew that we had good insurance, and it did take care of it. It was simply a restatement because somebody had overstated $300 somewhere. But you take a deep breath that folks that don't have that. And what had happened had my wife not been a teacher, and then we did insurance, had I not worked for a great company that turned into Alcoa later and gave us good insurance on top of our Medicare. But wouldn't that just make you feel terrible? I mean, what do you do? And I know folks that had that problem. We've had friends that work for a large bank, and things happened to them, and they did not go to the doctor. And that poor lady passed away in her early 50s because she didn't get medical care. Anyway, what the letter said to me that concerned me was that, we have to fix things. Well, I was in the business of fixing things. Industrial engineers fix things. Accountants fix things, Senator Stosh. We know how to fix things, and we go about doing it. And that can be done. We need to do it. It says that we will save $1 billion in the process through 2022. I know there are questions about that, but that's a lot of money to leave on the table. And I know there are questions there, but we can fix them. And all we have to do is work on it. And I'd appreciate if you all would go ahead and expand Medicare and let some good folks fix it.